Thank you, Mr. Chairman, and thank you for calling this hearing today. We certainly appreciate it, and thanks for all the distinguished witnesses. I want to offer a special welcome to Dr. Eric Novak from the state of Arizona. Well, it's been an absolute privilege, Eric, for all you've done for Arizona, the patient-doctor relationship, and across the country. So thank you so very, very much. It was great seeing you traverse Arizona all those times. You know, we need a patient-centered reform, not reform dictated to every doctor's office in the country from bureaucrats. In fact, as a dentist for over 25 years in private practice before coming here to Congress, most of the symptoms of our ailing healthcare system come down to one root cause, the fracturing of the doctor-patient relationship. When President Obama set out to pass the healthcare reform package, he promised doctors that little would change for them in their practices and that the folks who didn't have insurance would now have it. Today's hearing will examine the ways in which this promise has rung false. The President's health care law is full of reporting requirements and regulations for practicing physicians. It stands to reason that the larger practices or hospitals will have greater leverage to handle these requirements than a sole practitioner. Physicians in my district are worried that the private practice model will erode and eventually be unsustainable. Such a development would be devastating to the practice of medicine. The law also contains over 100 new boards, panels, and groups of bureaucrats to manage and dictate healthcare decisions, and gives the Secretary of Health and Human Services unprecedented authority to dictate standards of care across the country. Imagine a Washington bureaucrat sitting with you in the doctor's office as you're examined, as you discuss delicate issues concerning your health. That is the effect that this law will have on the doctor-patient relationship. Furthermore, the proposed expansion of an unreformed broken Medicaid system will be unmitigated disaster. What good is expanding Medicaid if the program is such a bad deal for providers that a Medicaid card isn't worth the paper it's printed on? When I was a dentist practicing in a low-income area of a rural community, I found that I was better to deliver care to people of all incomes and ages when I took the Medicaid system out of the equation entirely. We need to come together as a nation and find ways to lower the cost of health care for the young, the old, the healthy, and the sick, not pursue party-line legislation that enriches bureaucrats and special interests at the expense of our health care system. Let's reinnovate the doctor-patient relationship with a patient-centered, patient-friendly health care system. And I yield back the balance of my time.